Today is a special day on Jasiri as it marks our 2-year anniversary as the show that you have come to love. It's been an incredible 2 years for us as well. And in all, we couldn't have done it, without you. You guys have been there for us, so we love you so much. So thank you for the last 2 years. And here's to another great year of great conversation, needed debates, probing discussions, and the one-of-a-kind Jasiri vibe. You don't get it anywhere else but here. We're not celebrating today, so just relax. But we just started the show, by marking the day, letting it just go down in history that yes, the 8th of January.
Yeah.
I almost moved to February.
Move us, please.
It's our 2-year anniversary. So, ladies, you want to raise
Ladies. Since people did not let me bring my wine cup.
Which one?
My wine glasses.
No, what?
Thank you.
No, we have.
Thank you for all the tea that spills, the tea that is kept, and all the conversations. Thank you to all the guests who have answered our call over and over again, and those who have trusted us to be our guests for the very first time in many, many ways over many, many conversations. We celebrate properly tomorrow.
Yeah.
You're not ready for what we're planning.
Talawa.
As in,
That's the first thing I
tomorrow
heard
is not Italawa.
from you.
Italawa.
This table.
Yeah, but Italawa is
Put
what
it
we're
here.
doing tomorrow.
Put it here. What is Italawa?
We're doing a slight
outside.
Bear anniversary.
What's the difference?
It's not.
Is it not party or is it going out? I don't understand.
Italawa means we're outside.
We're literally inside.
No, you're not.
Put it here. We're outside. We're coming outside. Inside.
You're not. People are telling you no, it's not. You want to continue in your ignorance.
Sorry, man.
Outside girl,
Because we have plans.
Yes.
But let's rein it in, ladies. Let's rein it in. Because today on the show, we're looking at two stories that intersect in the most painful way: safety and survival. In Abuja, commuters are increasingly boarding vehicles in fear as the menace of so-called one-chance robberies turns everyday movement into a life-or-death gamble. And in the same breath, we're asking hard questions about Nigeria's healthcare system, a system already stretched thin, now grappling with loss, exhaustion, and the human cost of insecurity. These are not isolated issues. They speak to how protected we are, how supported our workers feel, and how much value is placed in human life, whether on the road or in the hospital. So today we connect the dots and we unpack what must change. Don't forget to join all our conversations on WhatsApp. The number on WhatsApp is +234 705 500 1212.
Well, we start with the chilling trend of violent crime gripping Nigeria's capital, the rise of what is locally called one-chance robbery. And a cruel twist of fate, a nurse finishing her shift at the Federal Medical Center, FMC, in Jabi was found dead on the roadside after boarding a commercial vehicle that turned out to be a trap set by suspected one-chance robbers, a type of criminal gang that lures unsuspecting passengers into vehicles, robs them, and sometimes leaves them to die. Now, the death of Chinemerem Chuwumeziem has drawn fresh outrage from professional groups calling for urgent protection of health workers and commuters, but it is hardly an isolated incident. Now, for months, residents have been warning about the prevalence of these gangs, and law enforcement agencies have made sporadic arrests, yet the menace continues to claim lives and spread fear on Abuja's roads. We're joined right now by News Central's Abuja correspondent, Bettina Nwelih, to, speak more on this.
Good morning, Bettina.
Good morning. Thank you for having me, Jasiri ladies.
Thank you so much. So let's get into this conversation. Now, from your reporting on the ground, how would you describe the evolution of one-chance robbery in Abuja? Has it become much more violent and much more frequent, or is it still something that is quite sporadic?
Well, thank you, Tolu. From the information that I have and from the research that I've done so far, I've gotten to understand that a year, 2 years before now, It has been really, really bad. The rate of kidnapping in Abuja was terrible. And then with the new administration, things calmed down a little bit. There was a bit of hope and, respite for the people. But in recent times, it almost seems like there's a resurgence. It's coming back, and it's coming back fast. Now, after the case of Chinemerem, we also have the case of a new person who is alleged to have been a worker at the courts in Abuja, who was also found by the roadside just 24 hours after Chinemerem. So it's almost becoming a pattern. And let's not also forget that there are probably cases that are not even reported, that people don't come to the authorities with. So I would say that we are seeing a resurgence in Abuja, and it's something that the authorities really need to pay attention to. It doesn't make sense that you are, you go out for your daily bread, you're coming back to the house, but you never get home. You are working, everything you do is legal, you are paying your taxes, but you don't have the security that the authorities need to put in place to make sure that you are actually safe as a citizen of the country.
Wow. Bettina, the killing of Chinemerem Chukwumeziem has indeed sparked outrage among health workers. What would you say is the public reaction, within the metropolis of Abuja, especially among frontline workers? Are there been protests? Have there been outcry? What would you say has been happening in that particular sector?
There has been outcry within the sector in itself, but we haven't seen any protest yet. Trying to speak to some people, no one wants to speak on camera. However, people on the streets are reacting to these issues. They are talking about why the security is not put in place, because you're passing some areas in Abuja at the night. There's no police, there's no, neighborhood watch, there's nothing. So all those places are left porous for criminal gangs and criminal activities to take place. And it's really becoming worrisome. I understand why the frontline workers will refuse to talk to the camera at this time, because they are also mourning their loss. I mean, it could have been any one of them. But it's a terrible situation, and I think that the government has to do something about it, and do something fast. Because when you give room for criminals to, play on the field as they like, they begin to think that they are invincible and nothing can be done to them.
All right, Bettina, let's take a look first of all. I mean, in this instance, let's talk about the commuters. How are they taking this? Are they talking about this menace? Was the temperature like there? Is it a matter of fear now and caution reshaping how people move around Abuja? And is it something that they're afraid of? Is it something that they've had to find new ways of moving around in the city, because it can be scary? Are there whispers or talks of probably like curfews, or what's the entire situation like right now in terms of whether fear and caution are redefining everything, how people move?
During the course of trying to work on this story, I did speak to someone off camera who has placed a personal curfew on herself. Now, she tells me that no matter where she goes to, she makes sure that, daylight doesn't meet her outside of her house. So she makes sure she's back home before it gets dark for her own personal safety. Away from that, we also spoke to some transporters, because, I mean, these people who are operating as one-chance operators are doing this under the guise of transportation. And some drivers are of the opinion that for the women who are victims of these one-chance operators, it almost seems like he was pointing fingers at them, saying they are responsible. Because he says that when they see their vehicles, because it's not flashy, because it's not the latest model, they look down on them, and then they stand by the roadside asking for lifts from vehicles that they don't know, from tinted vehicles that, once you get in, you cannot determine or, see what is going on inside the vehicle. So for that particular driver, he said that he thinks that the responsibility is on the women, because you cannot be asking for freebies and then expect that, oh, all will be well and good. Now, on the other hand, I wouldn't really say, because a bad person is a bad person. Whether you are taking lifts or you are entering a cab, If you are evil, you are evil. So that's it's for me. It's not really balanced. While he has his rights and he has a point there, but at the same time, if security was put in place, we would not even have to debate this situation in the first place. So yes, people are talking, people are pointing fingers. There are also a group of people too who say that the government is not doing enough. Because if security is put in place, then it curbs at least half of this menace that is going on. But when you pass through areas where you cannot even find policemen on duty at night or during the day, then we know that there is a problem. And then Abuja is the federal capital territory. If Abuja is not safe, then there is a problem.
All right, Bettina, speaking to, security and putting an end to the menace, can you give us a sense of how the FCT police and other agencies have responded, and whether arrests have been made or arrests have made a dent in the trend or only offered temporary relief?
Thank you for that, Dasha. Now, yesterday we reached out to someone in the police command, the public relations officer, SP Josephine Ade, and she told us that discrete investigations were ongoing, so she couldn't comment on it, and we couldn't get information on how far the police has gone regarding the case. But I did a bit of digging to find out, what has really been going on within the metropolis regarding security. And it will interest you to know that in the year 2024, according to the Abuja inquiry, a total number of 104 kidnapping cases were reported in 2024. Now, armed robbery cases were reported at 268, one-chance robbery cases were reported at 263, rescued victims from kidnapping were reported at 68 victims rescued, and then one-chance robbery victims were 19 in the year 2024. So you see, we now have to look at the data and look at what the Nigerian police is telling us, and then, try and balance it out to see how far we have gone. From 2024 entering 2025, was there a reduction or an increase? Because in 2026, we are barely a week into the new year, and we already have 2 reported cases of alleged one-chance victims. By the end of the month, we can only imagine what the figures will get to if the government does nothing about it.
Bettina, this is quite, worrisome, and, the law that we just hear from the government side is not sitting well at all. Would you say the government or the FCT administration, have they outlined like a coherent urban security strategy, especially targeting one-chance robberies and similar violent crimes? Because you did reel out some very important data. And if that data is on ground, so that means it's not something that is coming to them like surprise or shock. That means they should have put some kind of strategy in place to forestall these kinds of attacks on commuters. What would you say they have done? Any security, strategy that you have heard that they have put in place?
Well, other than the fact that they say that a discrete investigation is going on, there hasn't been any security structures put in place regarding the current situation or the recent situation that is going on. No one has come out to address the public. No one has come out to say, oh, we are aware of the situation, and these are the proactive measures that we have put in place to make sure that we reduce the reoccurrence of such situations. Nothing has been done as of now that we speak. Whether something will be done, consequently after this interview or before the end of the day or before the end of the week is something that we will just sit back and watch and, monitor the story to follow up with what is happening.
Thank you so much for this update. We'll keep a close eye on the story for developments. Thank you so much, Bettina. All right, so coming up next here on Jasiri, Nigeria's health system affects every one of us. And what went wrong in 2025 that didn't happen in isolation? After the break, we'll dig deeper into funding, accountability, and what Nigerians should realistically expect from the health sector this year, 2026. Dr. Saheed Babajide, Chairman of the Nigerian Medical Association Lagos State Chapter, he joins us right here on the Jasiri table. Stay with us.
Now, as we step into 2026, one sector that continues to touch every Nigerian life, from birth to old age, is healthcare. And yet, according to the Nigerian Medical Association, 2025 will be remembered as a lost year for the country's health sector. It was a year marked by overstretched hospitals, frustrated health workers, recurring industrial actions, persistent shortages of equipment and essential drugs, and a system struggling to keep pace with the needs of a growing population. Doctors raised alarms about poor funding, delayed salaries and allowances, worsening working conditions, and a steady loss of skilled professionals to other countries, all while patients bore the brunt through higher out-of-pocket costs and reduced access to care. So what exactly went wrong in 2025? Why did long-standing problems deepen instead of ease? And more importantly, as the new year begins, what must change to prevent a repeat of the same cycle? Joining us today on Jasiri is Dr. Saheed Babajide. He's the chairman of the Nigerian Medical Association Lagos State Chapter. He's here to help us take an honest look at the state of Nigeria's healthcare sector. Dr. Babajide, welcome to Jasiri. Thank you for joining us.
Welcome the viewer, welcome the...
And you know, just before you came on, we were talking about the death of the nurse in Abuja, suspected at the hands of one-chance operators, and you said you wanted to speak to that.
Yeah, let me first welcome with the family of the deceased, the Nurses Association of Nigeria. It's very unfortunate that this type is happening, especially happening in Abuja.
Yes.
I think the solution to it is for the association to look at the policy of shifts. Because olden days, there's a security in which they do 3 shifts, morning, afternoon, and night. Yeah. In terms of the security problem we have in this country, I think they should change it to two shifts. You come in the morning, you leave the afternoon, from the 4 to the next day, one option. The second option is that they do like, they come throughout the day and go back the next day. That one reduce issue. Because by the time they are going towards 7, 8, they'll be rushing home and all these things can happen. I think I'm just employing the government, the association, to look into that angle. It had happened in Lasut, in Lagos State. What they now adopted that policy. Unfortunately, they have gone back to the previous policy. And this is a call for everybody, both state and the federal government, to change that shift. In terms of if you are coming to hospital, you come in the afternoon, you come in the morning, you leave the afternoon, or you come in the morning and go the next day. That should be reduced. Because you have to look at the solution.
Yeah.
That is the most important thing. But following you have in Nigeria is that after this, everybody just go and sleep.
And that's the issue. So the nurses and other people will now have to adjust their own schedules. Yes. But how are we using our security agencies to make sure we stop this? So people are adjusting. Yeah. We're changing our timelines. We're changing our movements. But are the criminals having to do any adjustments because there's intensity of security on them? But it's still part of the conversation, but we'll pick it up another day.
Yes. Thank you very much, Dr. Babajide, for joining us. We're hearing that Nigeria's Medical Association described 2025 as a lost year for the health sector. You know, when I heard that, it's the way it settled on me a little, because lost, it's kind of deep, you know, when you look at it. I'd like us to start from there. What does the enemy mean by lost year? Because I'm sure even our viewers are wondering.
Yeah, thank you very much. That was the statement by the enemy Lagos State. It's a complete loss here, to be frank. You know, we don't need to be parabolating. Let's ask ourselves, who benefited from 2025 in terms of citizens from this health system? Number one, we have a lot of industrialization by doctors, by not doctors. Has it changed? As we are talking now, the US on strike. Now it's going to on strike.
It's going on strike.
That means nothing has changed. People are not getting what they're supposed to get. Number two, Japa is increasing every day. And no government from federal to state to local government, no, none of them is looking at how to resolve this issue. Has it changed? Even Japa increased more than before in the last year. As I'm talking now, some doctors are even leaving the country. Are they looking at how good? Two, out of pocket, has it improved? People are now going to unorthodox medical care because the price of drugs have increased. Almost every hospital that are increasing everything, like the what do you call it, the drugs, the theater cost, everything is increasing, and people are not going because they don't have the means. Look at the economic situation of the country. In view of that, to be frank, government have not done anything about the earth. I still failing. Unfortunately, we have a minister of earth that focus more on what you call research. It's good on data collection. But what is supposed to focus on what is impact on earth? One, on the provider, which is the earth worker. Two, which is the major one on the citizen. If the citizens are not getting anything, what do you want to say it? Unfortunately, the politicians are very, very smart. When the time of the, by the time you see next or in a few months' time, they will be promoting, they have done this on net, they have done this. They use education and health as a campaign strategy. But the problem I have with citizens is that we should ask them, what did you do for in terms of this healthcare delivery?
Accountability.
Demand accountability.
Speaking of that, let's settle down into the Abuja Declaration's 15% health budget target. And it has been long committed. It's a commitment that has been, it's not a today thing. So I'd like to ask, how far are we from that reality today? And how did the funding shortfalls practically affect healthcare delivery in 2025? Because when you talk about 2025 being a lost year, it is worrisome. Because if there's anything a country shouldn't suffer from, is the lack of medical care. And we seem to struggle with that a lot, especially in these times. So beyond the budget figures we see on paper, how has the funding shortfalls affected healthcare delivery last year?
Yes, you see, it's unfortunate that the declaration was done in this country, in Abuja. And we, like South Africa, Botswana, and some other countries, have even gone beyond 15%.
Yeah.
And Nigeria, we are even if we are giving, if we are still struggling, no, I don't call struggling. Deliberately, you see, when you are struggling, you are trying to movement, you are trying to move with the hindrances of it. But this time around, people are dead because they feel that the health and education in this country are not their priority. And the basic thing, which people don't understand, is not profitable to the politician. In the sense that doesn't have any financial benefit to them.
It's a financial outlay.
It's financial outlay. Just say yes, because you have to spend money. Yeah. You know, road and all those things. That's why you see in Abuja, the honorable minister is good, more concentrating on the road. You know, they have gone on strike twice in Abuja on it. It should be challenged because that is not profitable to me. Let me not go back to the main issue. Government, if 15%, what is the average of 15%? Is 7.5. If you are gone to 10%, you are moving towards 7.5, you are passing. But when you are still on 4 and 6%, that shows
failure.
It's a failure. I know that the mathematics is a failure. That means they are failing. And again, what they should, another even worse part of it is that even with this 5% they are even talking about, in terms of implementation, what in terms of the quantity of money that get there, even less than this 5%. If the money that are even giving is less from the, even the one that are even giving for the implementation is lower, even the one they are giving, those in the charge of the health system, like the minister, like the commissioner, like the directors, like the CMD, like MD, the one that get to them, what are they using it for? What is the benefit? The only problem we have in this country is corruption. So that is corruption. Until when we are ready to implement the little they are giving to us, we now see difference. And when from up, they are not giving enough, from down, the one you are getting, you are not even implementing it. Even the one they are giving them, if they are implementing it to 100%, I think we have seen some changes.
Kind of different.
But now, we cannot say any change because we have syndrome of corruption. That is the problem.
You actually asked a very important question, and it's a question that we have all been asking for a while now. But then Dr. Babajide would have to take a break, and when we come back, we'll look at the health workforce, brain drain, burnout, and industrial action. Do stay with us.
All right, you're welcome back to Jasiri. You're watching us here on News Central Television. Feel free to be part of the conversation via our WhatsApp platform. And we're back to conversations. Let's take a look at this. You know that no health system can function without its workforce, right? But yet last year, 2025, exposed just how fragile Nigeria's human resource base has become. Doctors and health workers faced burnout, delayed entitlements, poor working conditions, and of course, an accelerating wave of migration, all of which contributed to repeated industrial actions that disputed care. Our guest today is Dr. Saheed Babajide, the chairman of the Nigerian Medical Association, Lagos chapter. Dr. Babajide, so in picking up the conversation, let's look at last year, the brain drain, because you talked about it. The brain drain in last year, what specialties were hit the hardest? That's number one. And then what role did delayed salaries, allowances, and poor working conditions, what roles did they play in deepening that frustration?
Thank you. You cannot be able to say this specialty awards. You can only predict and say some specialty like the psychiatry, medical lab doctor, medical lab doctor, surgeons, and the thing is it because apart from that, even the one that even going out is not specialized people, that the young ones, that that percent of people that are going now are the young ones, in the sense that let me give you a situation. Doctor that finished about 10 years ago, or 12 years ago, cannot rent a house in Surulere. Cannot rent a house. I work at the Limon Children's Hospital. They cannot rent it. They have to go inside. But I'm telling you the truth. No doctor can buy Tokumbo. Even what rules are used for the one that even was that Tokumbo. Inferior Tokumbo.
Nigeria use Tokumbo.
No, not inferior than they use Tokumbo. They go to work on commercial, on motorcycle. I'm telling you, let people go and find out. That's why the word they are thinking that is to get out of this country. Before I have the belief that nobody, but now I can tell you they cannot avoid rent, talk less of buying car. That is the situation found out. And to that way, as I'm talking now, medical students,
they have not even graduated.
They are not graduated. They are thinking of going out. They are doing because they are not see future. And those are the things we are talking about. Government should look at the issue. Number is time of the delay allowance, delay payment. Something happened in Luton, I'm talking now. A doctor joined, as I want to see him before coming here, a doctor joined NAT strike. And the new management stopped his salary. And when the agreement with government, anybody that joins strike should be paid. What do you call that? Two, a doctor have issue or health worker have issue, instead of resolving it, you issue that person. The person that even getting peanuts, and you are issue that person. And the board now, look at this, I said, people, like, if you look at the system in their sector now, the bottom is those old people. Why you see the young ones, they are little. And the essence of it is that what now happen to the health system? Because when you see the old one more than the young ones, and when the old one retired, what happened to the system? We get to a stage in this country, I'm just telling you the truth, we don't have anybody to treat citizens. I was telling some doctor that we ourselves will be treating ourselves at the way we are going if care is not taken. And as I'm talking now, Nigeria is the second exporter of doctor, apart from India. But India is now moving back to their country. We now become first exporter of doctors. I will not get to a stage that we don't have any doctor to treat ourselves.
So that leads me to my next question. When does this issue of health sector workforce attrition, when does it become a national emergency? Because we're talking about doctors. We know nurses are leaving. So what we're doing is that there's a category, I think you might be among of, who have the years of experience. There's no one left for you to train. There's no one who's moving up, who's doing 5-6 years in surgery, who may in OBGYN or whatever. So we're not, as you guys start retiring, there's no one left to fill the gap. So we've declared a state of emergency in security. When are we going to declare a state of emergency in health? Or until all of us die?
You see, the problem of this state of emergency is more of statement than reality. They have declared security emergency in the country. What have they done about it? Kidnapping is still going. Banditry is still going. that declared state of emergency in education, what has it happened? Is the state of emergency, when you talk about state of emergency, what do you want to do about what do you mean by state of emergency? State of emergency means that we must take an action. And what action do you want to take the emergency? If you want to declare a state of, the first thing government should do is what we call, especially, I'm trying to advocate it for Lagos State government. We Lagos State government have not done before. What I call a summit.
Health summit.
A summit in the sense that the national level, we have a summit, in which case every government agency, association, stakeholder, what do you call it, the press, everybody will sit down 3 days, sponsor themselves. You see, the problem I have is when people sponsor, you don't go, sponsor themselves to that program, and we talk and look at what is the problem. That is the only way we move forward. By the time you get the day of emergency, if we are continue to have let's have what they call a summit and move this system. And we'll be frank with ourselves. Unfortunately, we tell the minister, we tell the commissioner, this is the problem. What do you mean by the summit? Number one they should do is to move health out of the core civil service. Because that is the problem we have, bureaucracy. Like what they did to judiciary. Judiciary is on its own. Tertiary education, lecturers, they are on their own. The civil servants on their own. Local government on their own. Let the health sector be on its own. That's why we now have national Health Commission. In which case you don't have any issue with bureaucracy. When you now do that, that's why from you now look at primary health care, secondary health care, tertiary health care. Primary health care should be domiciled with the local government and the state government.
Yeah.
Federal government doesn't have anything to do with primary health care. What concerns federal government primary health care? Wasting money. The secondary health care should go to the state, while the tertiary should go to the federal. What happened? By the time you give the 60% of it to the primary health care, if we reduce people going to general hospital, malaria, and all these things, by the time we do that, when the secondary health care reduce the pressure, prevent the complication that can occur, you go to secondary health care for higher operation or for something like that. This tertiary health care we are talking about, you'll be talking about some specialization, like endoscopy surgery, like arthroplasty, not that the same open surgery. You see, those are the things we need to sit down. And also financing. How do we finance? How do you get the budgetary allocation very well? If when we sit down and look at it, that's what we will be serious. We are not serious in this country.
You know, I'm listening to the doctor and I'm like, there's so much that we need to do for the health sector. And honestly, we need to really focus on what the way forward is, because we can't continue like this. This is 2026. The enemy is supporting the National Association of Resident Doctors in its plan to resume the indefinite strike on January 12, 2026. And this planned strike is tagged "No implementation, no going back." It's like no retreat, no surrender. It's expected to commence at 12 a.m. On that day, unless the government meets the association's outstanding demands. Now, critics often focus on strikes, talking about how the industrial action, affects emergency care, maternity health, and chronic patients in particular. But from the NMA's perspective, what alternatives were realistically available to the doctors? Because I know that your profession has this Hippocratic oath.
First, do no harm.
First, do no harm. You just want to take care of your patients. But now that it's as if your necks and your hands are tied, are there any alternatives to strike or to this impending no retreat, no surrender, no implementation, no going back strike that is coming?
Thank you very much. I like that when you say Hippocratic code. Unfortunately, fortunately for us, there's some clause down that inside this, because they are using it for, but there's some clause now inside it. And that clause says that you can only deliver when you are healthy. That one I deliver. If you are not healthy, you cannot deliver everything. First of all, you must be healthy before you deliver anything. If you are not healthy, how can you deliver? That's why I'm saying that the Hippocratic shows that you see, people understand. Let me just give a little bit of that Hippocratic code. There are 3 basic sector or lifestyle in the world. We have the doctor, the healer, we have the teacher, and also have the spiritual people holding this. Those 3 people, they don't take care of how they are going to feed. People will bring food for them. Their thinking is not about how to feed. That's why they moved out Hippocratic oath, is that the community will provide everything you need. You don't need to struggle. Therefore, treat these people. But this time around, the community are not doing what they're supposed to do. Therefore, we have to think about our own debt. That is one. Now, that what should be done. You see, let me talk about that strike. To be frank and sincere, that strike, the dreadful strike, the impending strike, can stop by 1 or 2 people.
Who?
Is the Minister of Health. Can you imagine, till now, from that strike, Minister of Health have refused to discuss with NAD leadership, calling them different names. Calling them, was a doctor, was he also part of a resident? He's a doctor, was part of a resident, and calling them different names. I even came out publicly that during that strike, hospital will work. Which hospital give us the type of hospital? Those are the related statements we don't need from our elder. What he's supposed to do today, he should have a meeting with the NAT. 2, he should tell the Mr. President. Because I know when Babajide was the governor of Lagos State, I've interacted with him. He knows how it is. That's what I'm saying between the 2 of them. If the minister can tell Mr. President the truth that there's a problem, not giving me wrong information, that strike will not occur. Now, what do we do? There's no option. The only option we do that, carry our bag and go out of the country, or we go into another version. You know that there's some daughter are going to music to every other thing.
Yes, so...
And daughter are going to music. God are going to invent something. They invent, send all those things. Yeah. Yeah. When they are dealing with the forces, we go into all those things. At the end of the day, who suffer? Unfortunately, the poor citizen. You see, the government, that's why I said that if this strike or not occur any day, the death of patient or citizen should be put on the blame of the minister. I can say in any way.
Let's take a break on that note. As much as we're looking back at 2025, we also want to look forward at 2026. When Jasiri continues, let's look at what the new year holds. Stay with us.
Welcome back. Now, as the new year begins, the focus shifts from diagnosis to direction, because after a year, many doctors have described as wasted. 2026 presents a narrow window to correct course or risk entrenching the same failures that weakened the health system in 2025. Now, let's talk solutions, because as we wrap up, let's look at also at priorities and political will. Dr. Babajide, what do you think must happen immediately? You know, what can no longer be postponed, and what will signal to doctors and patients alike that the health sector is finally moving from survival to stability?
Yes, thank you very much. There are some basic things that government must do. Number one, the first one is how to resolve JAPA syndrome and good remuneration for the health worker. There are three basic things to resolve JAPA syndrome. Good remuneration along with corresponding inflation. I use that word, along with corresponding inflation. Because what I collected as a junior doctor in terms of dollar relationship is higher than what I'm collecting now. Because people understand, it's not about the money they have given. You understand where you are coming. The value, that value is the, that was corresponding to the inflation. The second one is what we call welfare package. Welfare package is a simple thing. We are not saying you should give us free. Let's have a mortgage, housing mortgage. If I have housing mortgage for 15 years or 10 years, where am I going? At a reduced premium. Therefore, you are timing that. Yeah. If I have a new car every 5 or 6 years, which I'm paying for, you are timing that. Doctors, like to be frank, they don't live in fragmental life. If you have those basic things, every other thing resolved. The other thing, let me go have my training and retraining. Let me can go for vaccine and go for treatment. Therefore, if those things are available, JAPA will reduce completely. Now, that is the type of JAPA. The other thing is the issue of primary health care. As I said, let primary health care be a focus for this year. At the federal level, also at the state level. Increase the funding for health system. By the time you increase the funding for health system, you must have a commission that check and balance, especially for the MD and MD, CMD, to do, and the Ministry of Health to implement it according to what is on paper. not according to their dictate. The third one is relating to patient. Universal health coverage. Let's focus on health insurance. You see, health insurance, we have about 5 to 7% of health insurance. And where government has the problem, and they are not focusing, they are lazy. I've told you the word. They are collecting money. Majority of the people that are in this are the worker. If they can collect their money because the money, they are the one giving them salary. They should expand, they go to the formal sector, go to the private companies. Also, the major percentage is 60% that is go to the informal sector. Your lawyer, the market will go. Explain it to them. What you need, you don't need to go to, if your market is Oyinbo, you can just branch a primary health care or a private hospital. And that way government will work with the private hospital. Because in Lagos, you have about 300 primary health care centers. Well, you can't cover much. Work with private hospital. If you are in Oyinbo, that's a private hospital, primary health care, you can just go, hey, you have this thing, they take your BP. That will reduce a lot of things.
Yes.
So much.
That will reduce a lot of things. And therefore, government should focus on those type of things in order for to move. And again, they should discourage medical tourism. How
can they discourage it when they are probably the number one?
The only way they can discourage me, nobody can tie them.
By example.
The only way they can discourage it is for them to implement what I've said before the COVID, during Ebola. I said that at that time that each region and state should have infectious disease hospital. And now, the same thing you have now. After COVID, everybody just went and sleep.
So
every region should have disease. You don't need to go to Irua or you go to Yaba. As I'm talking now, every region should have, even every state should have infectious disease control. If any outbreak comes, you are ready.
Close. So, Dr. Babajide, time is not on our side, and I said I wanted to ask that because of the budget. So let's quickly look at that. Now, during his recent budget presentation speech, President Tinubu said that health would receive 2.48 trillion naira, coming fourth behind defense and security, which receives 5.41 trillion naira. Infrastructure is second, getting 3.56. Then you have education getting 3.52 trillion. And then, of course, health rounds up the top four of a total 58.18 trillion naira. The large part of your budget is going towards debt financing. Now, what does the budget allocation tell you about how government is prioritizing the health sector? And from what you have seen in terms of sitting as the NMA Lagos chairman, are you cautiously hopeful about 2026 or deeply concerned? You have just about a minute and a half because of time.
I'm deeply concerned that nothing can come out of this budget. Because the government, as I said earlier, security infrastructure is a money venture. Education and health is not a money venture. Therefore, all those figures they are giving, they've not implemented. They just focus on security that they are not even resolved. Infrastructure problem they have been having, they've not resolved. Because they want to do, if government is serious, they should increase the allocation to education and the health, and also food implementation. That is where we are going to move and make sure that remuneration, universal coverage, primary health care, and proper infrastructure. If those things resolve, the Nigerian system will move forward.
And I think what we also miss out on is that it's a journey. By the time you are increasing money and allocation to education and health and making sure that the money is used to implement, you can, in a 5, 10, 15, 20-year time, see a reduction in how much money you have to put into defense and security.
Yes.
But as long as we don't do that.
And again, is that security and defense. Look at what causes no education. Where do they go? People that are not educated. If I'm educated, I know how to defend myself. Yeah. If infrastructure, if I know what to do, I'm educated, I'll be able to provide infrastructure for myself. Therefore, if we do infrastructure, also reduce the defense. But when people are not educated, the lack of security around them will be. Therefore, government should look at inward, look out of the box, and move the country forward.
Wow. Thank you so much, Dr. Babajide. Very insightful conversation we've had on the show today. What we've heard today is a sober assessment of the health sector under strain, from funding gaps and workforce exhaustion to policies that struggle to move beyond the paper. If 2025 was indeed a lost year, then 2026 becomes a test of resolve for government, for policymakers, and for all the stakeholders who shape how healthcare is delivered in this country. The message is clear. Nigeria's health system cannot afford more drift. Lives are at stake, trust is fragile, and the cost of inaction is measured not only just in numbers, but in human outcomes. Our thanks to Dr. Saheed Babajide, the chairman of Nigerian Medical Association Lagos State Chapter, for joining us and sharing his insight. We'll continue to follow these issues closely because healthcare is not optional, it is fundamental. We'll see you again tomorrow.
It's an
Anniversary day.
Anniversary.